Three words that changed my life after 5 years of night shifts and missed holidays. Digital health career. Stop scrolling if you're ready to use your clinical experience to earn more while working less. Let's be honest about something most healthcare professionals know, but few talk about openly. The healthcare system that we all join to help people is burning us out at record rates. I remember the moment I realized I couldn't do it anymore. I had missed my own birthday because of a last-minute shift change. I was exhausted, frustrated, and I felt trapped in a system that seemed designed to drain everything from me. Does that sound familiar to you? But here's what I discovered that changed everything. The same clinical knowledge that makes you valuable at the bedside is actually worth more in digital health. Think about it. Every health app, electronic health record, telehealth platform, and digital health solution needs people who understand real healthcare. Not just programmers and tech experts, but people who've been in the trenches and know what actually works in real clinical settings. And here's what nobody tells you. Companies are desperate to find clinical professionals who understand technology. They need your expertise badly, and they're willing to pay for it. One nurse I worked with went from making $72,000 a year, working nights and weekends, to making almost $100,000, working Monday through Friday from home. And she still feels like she's helping patients, just in a different, often more impactful way. So what exactly are these digital health roles? Let me break down the three most popular paths I see clinical professionals taking. First, there's the project management route. These roles focus on coordinating digital health initiatives, ensuring they meet clinical needs while staying on track technically. Average salary? Between $85,000 and $110,000, often with remote options. Second, we have clinical analyst positions. These professionals evaluate healthcare data and systems to improve patient outcomes and clinical workflows. They typically earn $80,000 to $120,000 a year with excellent work-life balance. Third, the implementation specialist path. These roles help healthcare organizations adopt new technology and digital tools effectively. This is perfect if you enjoy teaching and problem solving. These positions usually start around $90,000 but can quickly grow to six figures with experience. And here's what makes all of these roles different from bedside care. Predictable schedules, often remote or hybrid options, no nights, no weekends, and most importantly, no more feeling like you're drowning in an understaffed unit while trying to provide quality care. Now, I know what you're thinking because I thought the exact same thing. I'm not a tech person. I don't know coding. I don't understand all that digital stuff. That's the biggest misconception holding clinical professionals back. The truth is, you don't need to be a tech expert to succeed in digital health. What these companies desperately need is your clinical expertise and your ability to translate between healthcare and technology. That's a skill you already have after years of explaining complex medical concepts to patients. I've helped tons of nurses, doctors, and other clinicians make this transition, and almost none of them had significant tech backgrounds when they started. What they did have was clinical knowledge and a willingness to learn. The technical skills you need can be learned on the job or through short courses. It's your clinical background that gives you the edge over pure tech professionals. Let's talk about something that matters to all of us, the impact on patients. Many clinical professionals worry they're abandoning patient care by moving to digital health, but the reality is often the opposite. Think about the scale of impact. At the bedside, you might help 8 or 12 patients per shift. In digital health, you're influencing systems that touch thousands or even millions of patient experiences. This isn't abandoning healthcare. It's transforming it from the inside out while reclaiming your life in the process. So how do you actually make this transition happen? Let me outline the three most critical first steps. First, identify your transferable skills. Your assessment abilities, clinical documentation experience, patient communication skills. These all translate directly into digital health roles. Second, look for entry points that match your background. If you've worked in a specialty, look for digital health companies in that same space. Your specialized knowledge is incredibly valuable there. Third, position yourself correctly in your resume and interviews. Most clinical professionals make the mistake of focusing too much on their direct patient care experience. Instead, highlight your experience with electronic health records, your ability to adapt new technologies, and any projects you've participated in that involved improving systems or processes. This approach has helped my clients land interviews at companies they thought were out of reach, often resulting in offers that increase their salaries while dramatically improving their quality of life. Remember those 3 words that changed my life? Digital health career? They can change yours too. The truth is, you've already done the hardest part. You've gained the clinical experience that these companies desperately need. Now it's just about bridging the gap between where you are and where you want to be. Think about what your life could look like in just a few months. No more night shifts, no more missed family events, no more physical exhaustion from 12-hour shifts, no more feeling like you can't provide the care patients deserve, and often a significantly higher salary, all while still using your clinical knowledge to improve healthcare. The digital health revolution needs you. Not despite your clinical background, but because of it. Your experience at the bedside is exactly what will make you invaluable, helping build better healthcare systems. If you're ready to explore what's possible for your career, drop a comment saying digital below, and I'll send you my free guide to the top digital health roles for your specific background. And if you know someone who needs to hear this message, a nurse, a doctor, or any healthcare professional feeling burnt out and trapped, share the video with them. You might just be changing their life. Before we wrap up, drop a comment and let me know, what's the biggest question you have about transitioning to digital health? I read every comment and use them to create videos that answer your specific questions. Thanks for watching, and I'll see you in the next video, where we'll dive deeper into the specific digital health roles that are perfect for your unique clinical background.